Good morning. Boy, it is so fantastic to be here with you today. I am so grateful to have the opportunity to share my thoughts with you this morning about rebuilding trust in public health. So I'd like us to think about the crisis that we're facing in public health. I think that we all know the crisis did not start with COVID. In fact, it's been building and developing over a number of years. All we have to do is think about the myriad of issues that all of us at this conference are working on, whether that's opioids, gun violence, the epidemic of Black maternal mortality, Black infant mortality, childhood obesity, tobacco, the list goes on and on. But what's different about our experience with COVID is scale. Not only the scale of the sickness, the suffering, and the deaths, but the scale of the social disruption that COVID has caused in our country and across the world for the past 3 years. The economic disruption, the social disruption, not to mention this incredible phenomena of misinformation and disinformation actively being pushed back against public health leaders, and public health staff members. So we're actually in this very unusual, unique moment in which public health is more visible than it's ever been, and at the same time, it's more misunderstood. And it's kind of getting underneath that issue of misunderstanding in public health that I'd like to explore with you today. Because I think what's at the heart of the misunderstanding is this issue of trust. Now, you can look at the literature and see that trust has been identified as such a key component to public health interventions going back. But what's been unique about the pandemic is really a remarkable study that was published in The Lancet last year that looked at all the possible issues that could influence COVID infection rates and really looking at those that could be modifiable and particularly could be impacted by policymakers. And what they understood and identified was that the issue of trust for government, and trust of neighbors for each other to do the right thing, was actually the most important factor in understanding the variation in COVID infection rates. And just in January of this year, we saw another study that came out and identified that only a slim majority of American adults believe that public health can be trusted to protect us from the next pandemic. So this issue of trust is really an existential threat to all of us in public health. How do we approach it? Where do we start? So I think we actually have to start at the basics. We have to start by asking ourselves, why did we take on this work? Now, I think that Mark Twain put it best when he said the two most important days in our lives are the day that we were born and the day we figured out why. Now, my guess is that most of us in this room, part of figuring it out why we were born has a lot to do with our professional choice to work on promoting and protecting health of populations. But if you're like me, I know I didn't find my way to public health in kind of a straightforward way. For me, my journey to public health started in nursing a long time ago. I was only 12. But it almost didn't lead to public health because it almost ended with nursing. And what happened was I wasn't one of these nurses that many of my colleagues are that are in love with nursing when they go into nursing school. I wasn't that person. And in fact, once I got through nursing school, passed my state boards, got my first job in a teaching hospital, and worked there for a couple of years, it was like, I'm having some good moments here, but I think we're kind of heading toward a breakup, me and nursing. So, fortunately for me, I got out of the hospital and into the community. And I got a job as a school nurse working for this remarkable woman, Dr. Helen Bruce. Now, Dr. Bruce was health commissioner in the city of St. Louis when I started. And Dr. Bruce was one of these remarkable public health leaders, post-World War II generation, that had this connection back to some of even the founders in public health. And she and her colleagues took on some of the biggest challenges: communicable diseases, tuberculosis, polio, measles, and virtually defeated them. And what I learned from Dr. Bruce was that if we're able to connect our day-to-day work with that purpose that we feel in life, that we actually no longer have a job, we have a calling, we have a vocation. And that's important because what it means is that we're part of a community of practitioners that share some important aspects, like basic assumptions. The couple listed here on the slide are just examples. So for example, as public health practitioners, we believe that we and others make choices based on the choices that we have. That, in other words, our choices are shaped by the systems and circumstances of our lives. And further, we believe that health is so much more than not being sick, right? It's total well-being. And it's absolutely essential for humans in order to thrive. Now, as a profession, we also have a set of values that we share, some of which are listed on the screen. These values and principles are actually lifted from our code of ethics, which is another important part of being this professional community. We have a set of beliefs that we hold strongly and that we hold in common. And then finally, we do have this history. We have this remarkable history of legacy from Dr. Bruce and her colleagues and the founders of public health in the 20th century who did this amazing thing. They added 40 years of life expectancy for Americans in the 20th century. So that brings us back to the question that's facing us. What, given everything that's going on, the crisis that we're in, what will be our legacy? And I will tell you that I'm very concerned that our legacy may be shorter, sicker lives for the American people. What we've seen over the past several years is, compared to our peer countries, we're actually losing life expectancy in this country. And this predated COVID. It's been exacerbated by COVID. And it's important to note, too, that these differences in our population are growing. The gap between whites and communities of color in life expectancy is growing. And when we look back again at COVID, it's so important to note that not only is this number huge and outrageous, but the number and the impact, that absolute number, is just part of the story. The other part of it, the most important part to really make sure we all understand, is the disproportionate impact on our communities of color and our low-income, low-resource communities. And the fact that this 1 million deaths actually is just the tip of the iceberg. Because what that 1 million deaths represent is over 5 million years of potential life lost. Years of people not being able to work, not to be able to provide service to their community, not being able to join their families for celebrations or sorrows. So as we look at this, what I would remind us from Deming, who is the founder of quality improvement and performance management, is that every system is perfectly designed to get the results that it gets. So our public health system, this fragmented, disconnected, underfinanced, understaffed, governed in a variety of different ways, at a variety of different levels, disconnected from healthcare and from social services, this public health system has gotten the results that it's gotten. And when we stop and think further about the levels of both cultural and social, political polarization in our country and the campaigns of disinformation, it's no surprise that our system is in crisis and has gotten the results that it's gotten. So what do we do? Because we know, we feel this. We feel the urgency of it. That's why we're all here, trying to figure out where we go, what do we do next, how do we up our game? Well, if we want different results, we have to do things differently or do different things. Because unless we change the systems and the structures, the results will remain the same. So we know this, and again, it's an opportunity, I think, for us to take that introspection about us as individuals and turn it out and look at us as a community. So as a community of practitioners, what's our comfort zone? When we start approaching a problem, where do we start? Well, I tell you, I think that we are, if we're going to be honest, we're science nerds. We're policy geeks. We like to get into the details of things. We like to look at the complexity. We like to try to understand it. We like to really geek out on how to describe it exactly. We want to understand the evidence. We can come up with these great technical fixes, and that's what our comfort zone is, right? Right? Let us do the science. Let us use the evidence, right? Well, I think in this instance, it's actually the wrong place to start. I think where we have to start is with our hearts. We have to admit that this system that we're a part of, that we have a variety of roles in, that this system got these devastating results, and we're heartbroken. We're heartbroken. So we actually have to lead with our own vulnerability in this moment. And I think what we need to do is create space for public acknowledgement, public grief, and public marking and celebration of the lives that have been lost. We learned this in the AIDS pandemic in the early 80s, that only if we find the opportunity to look behind the numbers and celebrate the people and mark our losses can we start to find the healing energy in our communities to go forward. So I think we need to start with this work of the heart. And I think we're starting to see in a number of places around the country, particularly with the 3rd year anniversary coming up, or essentially we're in this period of 3 years, that creating the space for public acknowledgement for loss and for grief is really important. But I think those of us in public health, Again, think about these issues of trust. It's not only trust for government, but it's also trust about your neighbor and your neighbor doing the right thing. And so being able to make those connections and reestablish those connections through acknowledging the losses is where we have to start. Then from there, we can start to build. And still, I think we don't start with building out on technical specifications. I think we start by really leaning into a conversation with our community about our values. What are our values? What do we believe in? And I think in public health, we have a strong case to be made that we really believe in and value creating a different future for our children and our grandchildren. We so strongly feel that everyone in our communities has the right to fair and just opportunities to live healthiest lives. And we as a public health community value listening and learning from our community members. I think if we start there and then go from there to really saying, how do we in everything that we do incorporate key, deep commitments to partnership, to openness, to accountability, and to service. How do we make those things operational? So again, starting by leading from the heart. Then and only then, I think, can we lead into the work of transformation, making the changes, making those things that we feel we do have a great deal of expertise in terms of policy, systems change, financial changes, workforce capabilities that we need, all of these things. But again, we always have to go back to connecting them to our values and our common humanity with our community. Now, the organization that I'm fortunate enough to be a part of and lead does have a whole set of tools to support public health departments in working on this work of transformation. And chief among our tools is our accreditation program. And I'm so proud that you're here in the state of California, where of course the state of California is accredited, and that you're in San Diego, which was one of our first early adopters of accreditation and just went through reaccreditation. And what we know is that the reason that accreditation is important at this particular time is that it actually helps communicate in a structured way to our communities what it is that we do and holding ourselves accountable for that work. So it really fosters a sense of transparency and accountability to our communities. In addition, and you heard the remarkable work of Live Well San Diego, in addition, it really lifts up the importance of partnership in public health because governmental public health cannot do this work by itself. And then lastly, what we've seen with all of our accredited health departments, and it's been so important during this time of COVID, is that there's a focus on service and a focus on continual quality improvement of those services. So again, we need to bind up our broken hearts. We need to work with our communities to build connections and to build healing by creating and holding spaces for acknowledging the losses and celebrating the lives of those who have passed. We can then build on this foundation of our common humanity and our common values with our engaged community members and community leaders, And then we can start on the road to transformation in terms of the policy, services, and financial changes that need to happen for public health in order for public health to truly become the catalyst for change in our communities so that everyone in our community has the opportunity to thrive. Thank you so much.